Good afternoon, everyone, and welcome to the University of Rochester's COVID-19 vaccine safety webinar. My name is Chris Apple. I'm the men's soccer coach on campus, as well as a member of the Genesee Staff Council. I'd like to introduce Dr. Angela Branch, Assistant Professor of Medicine and Co-Director of the Medical Center's Vaccine Treatment and Evaluation Unit, our Provost, Dr. Sarah Payray, our Vice President for Resources and Chief Human Resources Officer, Kathy Gallucci. I want to make note of the fact that American Sign Language interpreters will be providing translation during the webinar, and closed captioning is available. This webinar is being recorded and will be available on the COVID-19 Resource Center website in a few days. Questions were submitted by employees in advance of the webinar. Additional questions may be submitted via the Q&A button at the bottom of your Zoom window. Answers will appear on the COVID-19 Resource Center FAQ website in a few days. I'd like to begin by inviting Dr. Branch to give us a little bit of background on COVID-19 vaccine safety.
Okay, thank you. So I'll start sharing my screen. Can you please let me know if you can see it?
Yep, we've got it.
Okay, great. All right, so I'll just be giving you sort of a brief overview of the development and the progress in developing these vaccines, as well as the challenges of trying to get our nation and our world vaccinated. I like to start talking about this by just referring to the infection process. I think it's really important to understand exactly how you get COVID because it helps you to understand why and how the scientific community was able to develop these vaccines so quickly. So looking at this diagram, on the far left-hand side here is a cartoon of what a coronavirus looks like. And sticking out of the surface of the virus are these red-like projections that we call the spike protein. Now, this is sort of the structure of many coronaviruses, and there are about 100 or more strains in existence, 4 of which actually cause the cold every season. So you've probably been infected with coronaviruses once or twice a year for your whole life. And so we've known a lot about coronaviruses for many decades, and we've known that the spike protein is one of the most important parts of the virus. It's actually the part of the virus which attaches to human cells, and without that attachment cell, the virus couldn't fuse with that cell, couldn't become infected, and then the virus would use that cell to make more copies of itself and go on to infect other cells and cause diseases like pneumonia and so forth. So we knew more than many decades ago that if we could block this necessary attachment step, we could actually prevent infection. And so this became the important target for the development of both vaccines as well as therapeutic agents. And the question was, how do we train your body's immune system to develop antibodies as well as other defenses, which would bind to the spike protein and neutralize the virus, preventing it from attaching and causing infection. And if, for example, that spike protein or that virus was able to evade the immune response, other immune responses would then be able to search out and find cells that were infected and destroy those. It's important to remember that we're not teaching your body to do anything that it doesn't actually do naturally. So if you were infected with COVID and you recovered, this is something similar to what would happen, and you would have natural immunity. What vaccines do, though, is that they avoid you having to become infected and the risks that go along with that. But additionally, the response is much more refined. We're telling your immune system, this is the target. So identify that target, develop antibodies and other defenses to that target, and you'll be able to optimize your immune response to the virus and protect you if you were to be exposed in the future. I get a lot of questions about how we were able to produce these vaccines so fast. And I think this is an area that causes quite a lot of concern. It's true that a traditional timeline for developing vaccines is usually about 10 years. Having said that, it doesn't mean that we skipped any of the necessary safety or efficacy steps to develop these vaccines. And in fact, everything that we would do in those 10 to 15 years just got compressed into a 2-year timeline. For example, the exploratory step, which is where you're working in the lab to try to find the right target, those are things that we already knew ahead of time based on previous coronaviruses that we had thought would become pandemics. The preclinical step, which is where you have a product that you test in animals, That was conducted as normal. And usually you do the phase 1 trial, which is your first in human trial, and then the phase 2, which is sort of a larger trial, optimizing doses, and then the phase 3 trial in sort of a sequential manner. But rather than doing that, which would have taken many years, we actually allowed these phases to overlap and sped up the process quite a lot. Additionally, pharmaceutical companies started to manufacture these vaccines at risk, even without knowing that they would work, so that when we were able to prove that they were efficacious and safe, we would be able to start vaccinating people right away. And lastly, while the FDA process does require some time to gather all the information, there is a step in the event of a pandemic called emergency use authorization, which allows you to present the necessary safety and efficacy data in sort of a compressed timeline so that the FDA can review and give sort of a temporary authorization while you're continuing to look at these vaccines. And that's what we call emergency use authorization. There are 3 types of vaccines that have been developed and are available or will be available this fall. The first is the Moderna and Pfizer vaccines. Those are what are known as messenger RNA vaccines. And sometimes people ask me, what's messenger RNA? Is it something that's going to affect my genes? Is it going to cause me to grow an extra limb or lead to an autoimmune process or something that could be potentially dangerous? So I'd like to spend a minute and just talk about what messenger RNA is. First of all, I'd like to start by telling you that messenger RNA is actually ubiquitous. If you remember your high school biology or maybe even your college biology, you'll remember that every living thing, every living cell actually produces messenger RNA. Messenger RNA isn't actually the gene. What it is instructions that teach your cells how to build something. Your cells can't interpret genes. And so the gene gets translated into instructions, which is messenger RNA, and messenger RNA is then interpreted by your cells, and your cells use that message to build something. And what we're telling your cells to build is purified spike protein in its natural form, which your body recognizes as something foreign that shouldn't be there and starts to develop antibodies to that. So the Moderna and Pfizer vaccines are actually messenger RNA, again, instructions encapsulated in a lipid nanoparticle layer, which is sort of like an oily bubble layer. And that's packaged with preservatives and given as a vaccine. The Johnson & Johnson vaccine is made with sort of a more traditional approach where the spike protein gene, and you'll notice sort of a pattern that it's really all about the spike protein. That's the target that we're training your immune system to develop antibodies to. This time though, with Johnson & Johnson, the spike protein gene is embedded in another virus called an adenovirus, and that's given as a vaccine. The adenovirus can't really hurt you. It can't cause disease. It's been engineered so that it doesn't make more copies of itself. It's really just acting as a vehicle to deliver spike protein gene, which your body's cells then translates to messenger RNA about the spike protein, and then from messenger RNA to, again, starting to churn out spike protein against which you will develop antibodies. And then the last way that vaccines are being made, and this is how the Novavax and Sanofi vaccines are being made, which will be probably available either late fall or early next year, is just to deliver purified spike protein as the vaccine itself. We conducted the phase 1, 2, and 3 trials of these studies for most of them, at least the ones that are available, in 2020. And many of you are probably familiar with some of the results that came out of those phase 3 trials that were conducted in tens of thousands of individuals all across the United States and around the world. The Pfizer and Moderna vaccines, which are mRNA vaccines, showed an efficacy against all COVID infections of about 94 to 95%. This was better than we could have possibly expected because usually when we develop vaccines against respiratory viruses, we don't actually achieve these sorts of efficacy results. So it's really been just a remarkable achievement by the scientific community and one that we're very proud of. The Johnson & Johnson and AstraZeneca vaccines have somewhat lower efficacy against all COVID-19 infections, but that wasn't actually the goal of these vaccines. The fact that Pfizer and Moderna, J&J, AstraZeneca prevent colds in the vast majority of people is wonderful. But what you really want a vaccine to do is to prevent hospitalizations and deaths. And in the clinical trial, and since then in real world evidence, what we're finding is that these vaccines are actually really equal in their ability to prevent these severe outcomes as a result of being infected from COVID. And that was the goal all along. And while we feel very confident in being able to say, get whatever vaccines available in your community, it will protect you and keep you safe. These vaccines, like all vaccines, do have some mild side effects. This occurs because as you're vaccinated, that vaccine will turn on your immune system. It's supposed to do that. But part of that turning on can be mild inflammation, which presents itself as injection site pain, fatigue, headache, muscle or joint pain, chills, and very rarely fever. And this is what we're seeing with many people who become vaccinated with any of the 3 vaccines. It typically lasts about 12 to 24 hours and responds very nicely to Tylenol or Motrin. But there have been some rare potential side effects with all of these vaccines, and I think it's worth mentioning just because I know that this generates quite a lot of fear and concern in communities, and there's a lot of misconceptions surrounding these things. I'll start by saying that for every surgery, every medication, every medical treatment or vaccine that you get, there's always the potential of a rare side effect. And that's why when you talk to your doctor, your doctor's getting ready to prescribe something, they always talk to you about the risks and the benefits, and they only prescribe things where the benefit far outweighs the risk. So we know that with the Johnson & Johnson vaccine over here on the left and the mRNA vaccines over here on the right, we're saving thousands and thousands of lives and thousands of hospitalizations and ICU admissions for every millions of doses of vaccines given. And I won't spend too much time looking at these numbers, which I'm happy to share with you some other time. But what are the potential rare side effects? Well, with the Johnson & Johnson vaccines, there have been 2. The first is something called thrombotic syndrome, thrombotic with thrombocytopenia syndrome. That's something we're seeing primarily in women of childbearing ages. And this is something that we're seeing very rarely, where we might see as up to 10 cases for every million doses of vaccine given. That's less than 1%. That's less than 0.1%. And in fact, makes this vaccine very safe and this particular side effect very rare. The other is something called Guillain-Barré syndrome, which is the neurological syndrome that we actually see most frequently with people who are recovering from viral infections. We don't actually know that this is related to the vaccine, but it is something that we're tracking. And of 14 million doses of the Johnson & Johnson vaccine given, there have only been about 100 cases, many of which we have not been able to demonstrate actually are related to the vaccine. On the mRNA side, the only side effect that we're seeing that's serious is something called myocarditis, where we're seeing mild inflammation of the muscle of the heart in young men between the ages of 16 and 24. No one has died from this. Most of them aren't even being hospitalized, and it's something that we're treating with high-dose ibuprofen. In the United States, we have the luxury of not just having a lot of vaccine available, really more vaccine than we know what to do with, but we also have the ability of choice. And so these are conversations you can have with your doctor based on your age and your underlying medical conditions, which vaccine is best for me. Despite that, we've only been successful in vaccinating about 54% of the United States population, which is why we're seeing the surge of cases that we're seeing now. Part of that is also due to the fact that the virus is changing itself. Now, I hear a lot of questions about this, and people sort of treat it as though it's a science fiction type of thing, but it's really not. Viruses mutate, they're supposed to. Where do they mutate? They mutate in someone that they've infected. A virus doesn't exist outside the body for very long, so the more transmission we have, the more people who become infected, the faster the virus will mutate, the more new variants will emerge. And in fact, each one of these dots here in the first year of the pandemic represents a new strain of the virus that emerged somewhere around the world. Currently in the United States, the strain that's causing the vast majority of disease, which took over sometime around the end of May, is the so-called Delta strain, which is what you're seeing here in orange, that's causing 90% of infections in the United States and around the world right now. But that's probably not the end of the story. There may be a mu strain, there may be an epsilon strain. The quicker we can get people vaccinated, the less likely we are to see additional surges as new variants emerge. I'll spend a couple more minutes just wrapping up, talking a little bit about what we know about the Delta strain and why this has really changed the urgency a little bit, just increased the urgency, in fact, of us trying to get people vaccinated as quickly as possible. First of all, it's more infectious than the initial strain. For every person infected with the initial strain of the virus, they would go on to infect 2 to 3 people. That's what we call the R0 number. And that strain was very similar to flu, which also has an R0 number of 2 to 3. The most infectious virus in human history is actually measles, which has an R0 of 18. So that for every person infected with measles, they would go on to infect 18 additional people. Subsequent variants of the COVID virus have emerged, like the Alpha strain, which has a greater R0 than the initial strain. The Alpha strain had an R0 of 4 to 5, and the Delta strain has an R0 of up to 8. That means for every person infected with a Delta virus, they can go on to infect up to 8 people, making this strain of the virus up almost 3 times as infectious as the original strain. It's also no longer just a pandemic that's affecting older, frail adults with lots of underlying medical conditions. In fact, the average age of people being hospitalized with COVID is closer to mid-40s and early 50s. And in a recent study, about 70% of people who were admitted and hospitalized with COVID-19, 70% of them had no underlying medical conditions. So being healthy and being young isn't necessarily going to be the protection against developing severe COVID that we might have thought it was in the earlier part of the pandemic. Nevertheless, it is possible to be vaccinated and still get a breakthrough infection. This is another area of concern that I hear quite often with people saying, well, why get vaccinated if I can still become infected? Well, there's lots of reasons to get vaccinated, but the evidence also doesn't lie. As of August 30th, 2021, more than 173 million people in the United States have been fully vaccinated against COVID-19. Of those 173 million people, we've only seen 13,000 cases of breakthrough infections resulting in hospitalizations of death. Can you imagine that's 13,000 out of 173 million? So the vaccines are doing what they're supposed to do. They're preventing people from being hospitalized and they're preventing people from dying. We're also looking at this around the world in real time. How well do these vaccines prevent hospitalization against the Delta virus compared to the Alpha virus? And as you can see, regardless of what vaccine you're looking at, Pfizer in blue, AstraZeneca in red, or Moderna in green, when you compare efficacy against hospital admission in the Alpha virus versus the Delta virus, the lines are staying the same. And so the vaccine is working just as well right now against the Delta variant as it did against the original strains. Nevertheless, we are in a period of very high transmission in the country, and because it's still possible to become infected, that's why the CDC has changed its policy on masking and recommended that even if you're fully vaccinated, you should wear a mask in public settings that are indoors where COVID-19 transmission is high or substantial. That's pretty much the whole of the United States. And the last thing I want to say is that even though these vaccines are still very effective, 8, 10, even 12 months out from when you were vaccinated in preventing hospitalization and death, immunity will start to wane at some point. And as new variants emerge, it is likely that we will all need periodic updates of the vaccines and or boosters, at least for the next few years. We don't know if this is going to be forever. We don't know if this is going to be like flu, where you get vaccinated every season or not. We suspect not, but don't be surprised if at some point after about 8 to 12 months after you've gotten your first vaccines, if we might recommend that you get boosted at least once more. So why get vaccinated? Because even now, even with the possibility of breakthrough infections, these vaccines are still decreasing the risk of becoming infected by at minimum 60%, and in some studies and in some cases as high as 90%. They definitely decrease the risk of becoming severely ill, being hospitalized or dying, by still percentages that are very high at about 95 to 100%. And if you're not infected, you obviously can't transmit the virus. And even if you are infected, being vaccinated will mean that you shed the virus for fewer days, and that means a lower chance of transmitting the virus to your family or to your community. And I'll stop there so that we can move to the question and answer period.
Thank you, Dr. Branch. I'd like to pivot now to invite Sarah Payray to discuss the vaccine from the university's perspective.
Sure, and thank you, Dr. Branch. Every time I hear you talk, I learn another layer and appreciate the complexity of what this is, and it makes me reassured in how the vaccine is really protecting us. I first want to say thank you to everyone who's on the call, who's taken time out of their day to join us in this conversation. This is an incredibly hard time for us, and it's been hard now for 18 months. And I feel that with my work family, I feel that with my home family and in my community. And I know I'm feeling the pressure and the complexity of what people are feeling around this. And so thank you for taking time and giving us a chance to share a little bit more around some of that university decision making. Again, my name is Sarah. I used to work in the medical center. I've been here for about 10 years. A year ago, I moved over to the Warner School of Education. And then starting July 1st, I'm stepping in temporarily as the interim provost for the university. And I will tell you that this vaccine decision has been going on since the day I started as interim provost. This has been something that we've been considering. And I thought I was pretty plugged in and I knew why we were making decisions and doing things. But over the last 3 months, I've really grown a deep appreciation for the thoughtfulness and the decision-making and the principled leadership of Sarah Mangelsdorf and how she's trying to help our organization very broadly respond to the vaccine and care for ourselves and care for our community and find our path forward. These decisions are not made lightly and have been the main topic of every conversation I know that I've been in lately. A little bit of timeline and then kind of what I feel is our why of the vaccine mandate. If you go, last May, June, we started talking about returning to work. The vaccine was coming on board. We were seeing large numbers of people vaccinated. We first got our healthcare workers vaccinated and our teachers, and then in the elderly, and then it was going broad-based. And then I know because I have a 14 and a 17-year-old at home, I think it was April where we over 12 could get vaccinated. And it felt like we were turning the corner. It felt like the vaccine was going to allow us to go back to our work life. And the operations of the university have really changed over the last 18 months because of the COVID vaccine. And understanding and thinking through of how could we return to campus and return to all of our work environments as safe as possible really centered on the vaccine. And so thinking about what is the uptake of that and how can we encourage everyone to be vaccinated. We listened to Dr. Branch, we listened to Dr. Taubman, we listened to our medical experts who said the best thing we have going for us is the vaccine and keeping a mask on. And then we can see that we did not have any transmission of the disease in classroom settings last year, that we have figured out how to stay safe through the worst part of it and coming out of it, that if we listen to the science and we listen to our scientists and our researchers, that we know how to manage this. But we do recognize that it was still on emergency authorization. We still wanted to give as much knowledge and education to support people to make the decision in their own time and to go talk to their primary care physicians and make a thoughtful, smart decision. But then the Delta variant came in, right? And in June and July, we really started seeing numbers change. And so we implemented our masking policy indoors. And you would all see that that happened in the first. And then we really wanted to understand what our community profile looked like. So we implemented our mandate to just report your vaccination status because we wanted to understand And Dr. Branch, you didn't talk about this, but like herd immunity or whatever that might be, or what are we talking about in terms of how much of our population might still be exposed in some way? And then the FDA approved the Pfizer vaccine, and it was not on emergency approval. And that was a decision point that Sarah Mangelsdorf really felt comfortable and ready to then put the mandate in. And this mandate was really, and I don't mean to, I want to say this as authentically as I can. It is connected to our values as an organization. I think many of you have I Care on your badge, or you've seen the Meliora values. You see that we say we're an organization that leads with integrity and respect and openness and equity and inclusion. Thinking about how do we manage a public health concern that has touched all of us in many ways, and knowing that we believe in the science of the vaccine and are seeing what that could do. By implementing this vaccine, we feel that we are caring for, as the largest employer in the Rochester area, that we are caring for our community and for our workforce and for our students and our patients by mandating this vaccine and moving that forward. We knew it would be a difficult one, and we knew that there would be people who are not convinced yet and who have other perspectives to it. But we believe so strongly that this is the right next step for us, that we wanted to work through those issues, and we want to do it understanding that this is a, now Kathy Gallucci and I, we talk almost every day. I know, lucky me, I'm very fortunate. We talk every day. This is really a man-on-man. We're trying to reach out to as many of you as possible to understand what the barriers are for you and getting vaccinated, and what we can do to help support you making a decision that we just really truly believe as an organization, as a group of leaders, is the best decision to keep our community safe and to keep our organization safe, so that we can continue functioning and supporting all of our different activities. Kathy, do you want to build on that a little bit? You're muted.
I'm just never going to get over that mute button. Thank you, Sarah. I think that was really well said, and certainly Dr. Branch for your presentation. I think, as Sarah said, this has been a decision that's a long time coming. The entire senior leadership team at the university really talked about this at length. We talked with different groups of faculty and staff, and really got some perspective across the university. And again, I think we believe in the science, and our folks that have been working on this, and truly to watch us kind of evolve over the last several months as an organization into this, I think has been an incredible process. I want to say that just kind of moving forward right now, as you all know, our date for vaccination is September 27th. And currently we're working, our HR staff are working with leaders to really reach out to employees and make sure that everyone has the resources that they need. Sarah mentioned that. We certainly want to make sure that people have resources and information. I think that there are multiple options, obviously, community-wide to be vaccinated. The lobby pharmacy at Strong Memorial Hospital is currently taking walk-in vaccinations. So we're really trying to remove any barriers to individuals getting the vaccine. And we've also created resources to answer questions and respond to concerns. I think that Dr. Branch hit a number of those already. I think that what I wanted to just spend a couple minutes on is we've had a lot of questions about the exemption process. We believe that getting vaccinated is safe and informed by science, as Dr. Branch has shared with us. There is an exemption process available. There's an online portal, and staff may apply for medical or religious exemptions through that portal. So I think that one thing that I want to bring up that has been a bit of a source of confusion is some recent reporting that occurred just earlier this week. So previously, the state mandate denied religious exemptions for those who work in patient care settings. And on Tuesday, a federal district court judge in New York temporarily blocked the enforcement that excluded religious exemption as a basis for reasonable accommodation. And so essentially what happens from here is this temporary ruling means that New York State cannot prevent covered employers in these healthcare settings, and again, this is healthcare specific, from granting a religious exemption to the vaccine mandate and providing an available reasonable accommodation. I think it's important to note, just because there's been a lot of confusion across the university, the exclusion of the religious exemption did not include the entire university. It only was specific to the New York State mandate in the healthcare setting. So at this point, we will have to wait to see how this plays out in the court. We will be able to accommodate more easily than we did prior to this judge blocking this enforcement. And we'll just have to see how that plays out in the New York State courts as we go forward. So I really just want to reiterate that I know that this is a challenging time. There's a lot of information. We're coming out regularly with information. We're trying to organize it in a way that people can view it and see it and access it. And we will continue to try and refine what we're putting out there. So please continue to provide us with feedback. I want to just reiterate that I agree with Sarah that getting vaccinated is aligned with our Meliora and iCare values. And it's our obligation really to not only ourselves, but our patients, our students, our colleagues, and our community and friends. And so we know and recognize that the past 17 months have been really difficult. And we hope that as we work together, that we will be able to return to some sort of a familiar pattern in our lives through vaccination and working together following all of our public health guidelines. And so with that, I'll just turn it back over to Chris.
Thanks, Kathy. Thanks, Sarah. At this point, we're going to move to questions that were submitted by our employees. I want to mention that we received way too many questions to answer all within an hour. And the answers to those questions will be up on our COVID-19 resources page under the FAQ section. That includes questions that are being submitted today. I see several coming through the Q&A, so we will put all of those up on the COVID-19 resource page. So the first question, I'm going to turn back to Dr. Branch, comes from an employee who asked the question, why are people who had COVID-19 and recovered, why do they need to get vaccinated?
Yeah, that's a really good question. When you are infected with something, you do develop natural immunity after you've recovered from that infection. But when your immune system is exposed to a virus and it's trying to develop immunity, it doesn't actually know yet what the target is. And so it's sort of like thinking about playing darts, and you grab 30 darts in your hand and you're throwing them at a dartboard, and you just pick up all 30 at the same time and throw them right away. Some of them will land on the bullseye and some of them will be completely off. And that's in fact what happens with your immune system. Some of the immune responses that they develop choose targets that actually will be able to neutralize the virus, but many of them are not functional. And so when we vaccinate you, we're training your immune system. We're telling it, this is actually the target on the virus that you want to develop your immune response to. And so it's a much more refined approach that allows you to produce a lot of antibodies that can in fact neutralize the virus at various different parts of the spike protein. This is not just more refined, very often it'll produce sort of a broader response so that if the virus continues to mutate and change itself, you still have good neutralizing antibodies. And lastly, historically, we know that after you're infected and you recover, your immunity will wane. And so you will become at risk of becoming infected again, usually within 6 months or so of having recovered from that virus. Whereas with vaccine immunity will wane, but not as quickly, it seems, as natural infection. So vaccine tends to be not only more refined and more specific, but in many cases more durable than natural immunity. So for that reason, even if you got infected with COVID and you recovered, we would still recommend that you get vaccinated.
Thank you, Dr. Branch. The next question is for both Sarah and Kathy. If several remote workers have inquired, why do people working remotely, why do they have to get vaccinated?
Yeah, so Sarah, if you'd like me to start, I'm happy to do that. So remote workers are still expected to come to the university and interact with the university. The intention of the remote work was certainly to provide flexibility and really kind of look at it, where it's an opportunity, but it was never intended for people to go fully remote and never interact within the university or on university grounds. And so we feel it's really important to include our remote workers in this process. I think the other piece is that we know that the Department of Labor's OSHA office is developing a rule that will require all employers with 100 or more employees to ensure their workforce is vaccinated or tested. And this really impacts about, and this is organizations with over 100 employees, it impacts over 80 million workers. And so the reality is, I think that these are a couple key points in making sure that all of our workers are vaccinated. I don't know, Sarah, if you have anything to add to that.
No, I mean, I think you mentioned it. Much like we were adaptive and largely went remote with the vaccine, we are in the process of returning to campus and returning to different work environments. And this is a policy for all of us. We're one Rochester, and it's really just, it's a standard that we're setting for our entire community.
Thank you, Sarah. Thank you, Kathy. Dr. Branch, I'm going to return to you for this next one. Several employees have noted that in the past, vaccines have sometimes been recalled. How do we know that there won't be significant side effects in years to come?
Another really good question. We don't know for certain. There is a degree of uncertainty there, and I can fully appreciate that causes people some concern about these vaccines. But we also know the risk of what happens when you get COVID. And so again, with everything, it's about risk versus benefit. I will also say that the vast majority of side effects related to vaccines, I would say 99% or more, tend to happen within the first couple of months of being vaccinated. Why is that? It's because when you're vaccinated, you turn on your immune system, and part of that turning on is inflammation that can cause damage. It's also the time when you're most likely to trigger an autoimmune response. And so we don't expect to see vaccine side effects at 1 year, 2 years, 3 years, 5 years from when you were vaccinated, because once that immune system has been turned on, the training occurs, your immune system then sort of goes back to its baseline, which is sort of relatively quiet. I know people think, well, when we do studies, we follow subjects for 2 or 3 or 4 or 5 years, and we do sometimes. Many times when we do that, it's because we want to see how long the protection lasts. It's not because we're expecting to see side effects at 2, 3, and 5 years. So we don't as a scientific community expect to see late side effects after a year's time, which is why for development of any vaccine, what the FDA requires is 6 months of safety data. And only if you have 6 months of safety data are you able to apply for full licensure, which is what Pfizer has done.
Thanks, Dr. Branch. That's reassuring for someone like me who has children who have been vaccinated, so thank you. Kathy, what happens, Dr. Branch earlier mentioned side effects from the vaccine. So what happens if I get vaccinated and then I have some side effects and I'm not feeling well? If I can't come to work, what happens then?
Yeah, so we actually developed a policy. We provide a sick day for side effects, and the policy, because we noted the side effects are typically after the second dose of the Moderna and Pfizer. The policy covers the second dose of those vaccines and then first dose of others. We provide a sick day following that vaccine. And we did make the decision, should we end up in a situation, when we end up in a situation where we're having to do boosters, we will do the same with the booster shots. So we are planning that as well to make sure that people have coverage for when those side effects occur.
Okay, great, thank you. Dr. Branch, for people who get the annual flu shot, does the COVID-19 vaccine interfere with that, interact with that at all?
No, there's no expectation that getting vaccinated against the flu should be impacted at all by your getting your COVID vaccine. We vaccinate people against multiple things at the same time, all the time. When you think about your kids, when they go in for vaccines before they start school or at various different time points at 6 months, at a year, very often they'll get more than one vaccine. Vaccines are specific to the virus or the bacteria against which you are vaccinating, and they should not interact. So get your COVID vaccine and get your flu shot if you can.
Mm-hmm. Flu before boo, right, Dr. Brand?
Yes.
Get your flu shot before Halloween. Flu before
well, yes.
Yeah.
Thank you. So for Kathy and Sarah, what is the policy on testing requirements? What testing is required for employees who don't get vaccinated?
Yes, if you want me to take this one, Kathy, since
Great.
if you have received an approved exemption, and I know Kathy mentioned that process before, you are, and it's September 28th, and we've gotten past that deadline, you will receive instructions to do weekly testing. If you work in the med center, it will be in the medical center. If you work on River Campus or Eastman, we are setting up another testing site here on River Campus. For employees, it's going to be several times a day. There's going to be several days through the week that you can come and set up a regular appointment. You'll be contacted to make that appointment and show up, and you will have release time from work to go get that testing done. And we will track that. If you miss a week, if you're on vacation, that's fine. If you're off for that week, that's fine. But if you aren't compliant, you will, someone will reach out and connect with you to make sure you get back to being compliant. That being said, if maybe you really want the Moderna vaccine and then all of a sudden it becomes available, or you change your mind and there's something, we'll always be offering the vaccine at our testing sites, and we can always update your information.
Great, thank you, Sarah. Dr. Branch, if an employee has more questions about the vaccine and vaccine safety, where can they turn?
I think the best source of information about vaccines and vaccine safety will be your own medical doctor. I say this because I trust my colleagues here at the University of Rochester Medical Center, here in the city and in our county. There are lots of really great physicians, and there is consensus in the medical and the scientific community around how beneficial these vaccines are, how they are saving lives, how they are preventing people from becoming infected with COVID. So I think that's your first source of information, is go and have a conversation with your doctor about what they know about the safety and efficacy of these vaccines. I do also think that the University of Rochester Medical Center has really done a good job of putting together resources that I think will be very helpful to people, that really lays out the facts all the way from the development of these vaccines to their efficacy, to what we know about safety and breakthrough infections and transmission and everything. And then lastly, you know, I obviously I'm a scientist and a physician, so I value the work that the CDC is doing in the United States to track infection rates, to track vaccination rates, to understand side effects and so forth. And so that's another sort of more global place to look for information. But yeah, start with your doctor. They'll be the most helpful.
Thank you, Dr. Branch. Kathy, what if an employee has questions about the policy? You want to know more about the policy?
Sure. So employees should definitely talk with their manager if they have a question about policies, and then certainly our HR business partners are available, or Ask You Our HR is a quick call to talk with that team, and they have a number of resources to help them answer questions that employees may have.
Great, thanks, Kathy. I'm going to stick with you for this next one. What if an employee, you mentioned the exemption process earlier, what if an employee has submitted their exemption, but they haven't heard by the 27th?
Yeah, so we are moving through the exemption requests as quickly as we can. And so my recommendation is that you submit early for exemptions to allow us time to process them. If someone submits on the 27th, or if a number of people submit on the 27th, obviously all of those have to be processed. And so if we can't get through them on that day, then there'll be a delay in getting back to them, and they won't be able to work until we finish the review. So my recommendation is to get them in early, get them in before the 27th, and give us time to look at them and process them. The reasonable accommodation process, part of that is talking with their leaders. So we have to have time to have that communication. So I just encourage people to do it early, do it now, as much in advance of the 27th as they can.
Okay, thank you. Dr. Branch, we talked about testing earlier. What about vaccinated individuals? When should they get tested?
Right. So, as we talked about, a breakthrough infection is still possible with vaccine. No vaccine's perfect, and nothing does anything perfectly. So that's why the guidance is still that you wear a mask whenever you're in indoor settings, particularly large indoor settings. And then if you are exposed to someone with COVID and you do develop symptoms, you absolutely should get tested. And depending on the exposure, for example, if somebody in your household becomes infected, that might also be a situation where you might want to get tested about 3 days after you're exposed to someone who's infected, to make sure that you are yourself not infected and you don't have a mild or asymptomatic infection. So I think those are the situations under which, even if you're vaccinated and are taking all the right precautions, should still get tested.
Okay, thank you. Sarah, do you know our numbers, faculty and staff who have been vaccinated? What do our numbers look like?
Sure, and let me actually start with our students who, they had a due date of August 1st, which now we're well past, and actually out of 11,000 students, we had about 150 exemptions and everyone else became vaccinated. So we're very happy with that effort. Currently our employees, our entire employees, out of 28,000 of them, we're over 80% that have been vaccinated and verified. We do have another group that has at least one dose or that we're waiting to receive their vaccination verification. But we still have got a little work to do with a group of faculty and staff that need to either get the exemption in or get their first dose or let us know they've been vaccinated.
Okay, that's very promising. So given these high numbers for vaccinations in our community on campus, what does this mean for masking and social distancing? I'll pitch that to either Kathy or Sarah.
I'll talk about it from an instructional point of view, and Chris, as a coach, you might have some of your own feelings. With your, is it 4th in the nation, your soccer team? Is that what I've heard most recently?
Shameless plug. I'll take it.
Okay. So, about keeping our community safe, I think we're going to need to be comfortable with a mask, right? We have decoupled the masking and the social distancing because we believe that if you're vaccinated and you're wearing a mask, that you will not transmit or catch the COVID, any variant that we have. So I don't see us walking away from the masking commitment for a while. But like Dr. Branch said, we're going to really be following the CDC guidelines. And they are rating or evaluating each of the areas. And Monroe County is one of the areas that they do. If our numbers fall down an acceptable level, we will confer with our medical experts and talk about taking away that mask mandate. Right now, we're pretty fortunate because if you're outdoors that you can keep your mask off. But I would say that if we see numbers continue to rise or get any dangerous, that we would also continue that. The social distancing hasn't ended up being as important, not important, it's still important, but returning back to campus and getting back to full density and having everyone back at classes as normal, et cetera, those things have been, again, decoupled by the CDC, so we felt comfortable moving forward with masking and the vaccine.
Great, thank you, Sarah. Kathy, earlier Dr. Branch mentioned the eventual need for boosters. Is there any discussion or a plan in place to make booster shots available to students, faculty, and staff?
Yeah, so we are absolutely having those discussions. I think we're waiting for certainly the final guidance on what that will look like and who needs to have them. So as that comes out, we will make sure that the information is available for faculty and staff to understand how we will support the effort.
Great, thank you. Dr. Branch, returning to you, why do some people have more significant side effects from the vaccines than others, and what can they do to help mitigate those side effects if they are experiencing them?
Yeah, it's interesting. A lot of the side effects that people are seeing are related to inflammation. And so as your immune system is turned on, one of the first responses of your immune system is inflammation. And so we tend to see those in younger individuals whose immune system just responds very quickly and turns the fire up really high. And so they might have more side effects. We're seeing it less in our older adult populations. There's really not a whole lot you can do to mitigate the side effects. I would say if you got one of the mRNA vaccines and you had pretty bad side effects with the first one, you might take some Tylenol as sort of pre-medication before the second one, just to be a little bit more comfortable. But fortunately, these side effects, they don't last very long. They seem to be about 12 to 24 hours worth of feeling quite uncomfortable, and then it starts to ease after that. So yeah, just sort of par for course and not unexpected with vaccines in general.
Okay, thank you. So that concludes all of our questions. Sarah, I don't know if you have any final parting thoughts. You had a nice intro, I thought, so I don't want to put you on the spot, but if there's anything to finish with.
You know, one, I just really appreciate Dr. Branch's time, and I know Kathy and I talk regularly about how do we communicate and how do we show our support for our employees. Those who have been vaccinated, those who have not yet, you're all a part of our work family. And thinking about how to communicate, sometimes talking through this. I know that we do at Rochester. There's lots of different ways we communicate with each other, but really we want to understand the concerns, and we want to hopefully connect with information that will be supportive to where you are. I also want to put this in a larger context of COVID. It's being vulnerable, right? Underlying a lot of this is vulnerability. And I don't know about you, but I'm tired of feeling vulnerable, which I feel like has happened when COVID first broke out. And I was forced to change how I work, change how I interact with my family. I couldn't hug my mother for months because I was worried and scared by this disease. And now we're learning, it's not post-COVID, but we're learning how to live with COVID. And there's lots of different strategies to that. And as an organization, we're learning how to work and connect and communicate with COVID. And we're so fortunate that we are at such a wonderful institution that not only can give us the advice, but Dr. Branch, you're leading the charge in the science and the research. And it makes me so proud to talk to my children about what is happening here. And when we look back, I don't know if many of you, I was touched by all of the September 11th. And I can't believe that was 20 years ago. And I remember what I was doing and where I was at and how we all felt on really September 12th, where we all kind of came together about what this was. I can't believe that was 20 years ago. I wonder what 20 years will look like from now when we think back to when COVID broke and we had to learn how to live with all of this. And we all had different choices and a different agency and going to the grocery store, going to work, and whether we were fearful or fearful of the vaccine. This is just really a time that I know we'll never forget. And I feel really fortunate to be on the U of R family and that we can work and talk through all of these things together. I want to encourage you all to have compassion for each other and empathy for each other. I think sometimes there's undertones of fear drives a lot of maybe microaggressions or things against each other, and to just be compassionate. We all feel the way we do because of our life experiences and our perspective. And as an organization, the University of Rochester wants to support all of us to be as healthy and safe as possible. So, Chris, you're an awesome MC. Thank you so much for being our leader in this conversation and dialogue. And I'm just really grateful that all of our attendees, our participants, have taken the time to join in and keep the communication coming. We want to hear what you need to know. Thank you, Dr. Branch. Thank you, Kathy Gallucci, for your leadership. And, you know, this is cheesy, but I'm going to do it. Meliora, right? We're really just trying to be ever better. So thank you.
Meliora.
Yeah.
Thank you also to our interpreters today. Sarah,
Yeah.
thank you. Kathy, thank you. And Dr. Branch, for your expertise. Special thanks. This webinar has been recorded, and keep an eye out on @Rochester if you want to view the recording, as well as we will update the FAQ on the COVID-19 resources page with all the questions that were submitted today. Thank you, everyone. Have a great day.
Thank you.
Great job, Chris.
Thanks, Maggie. Is it not recording anymore, I take it?
I'm turning